Hey guys, today I'm talking all about sciatica with pregnancy. So very often patients will come into our practice that are pregnant with complaints of sciatic pain going down one of their legs or going down both of their legs. So I want to talk first about what is sciatica, number two, what's causing it, some things that you can do about it, and some things that you can do to help avoid it. So really quickly, a really quick recap, take my little spine here, and if we talk about sciatica, what sciatica is that we know that we have two sciatic nerves, right, which come off the spinal column here, go down the back of the leg. And what sciatica is when there's inflammation of one of these nerves. Now typically sciatica is when the nerve is being dragged along the bone. That is typical case sciatica. But what we typically see when we are dealing with pregnancy is when the muscles, primarily the piriformis muscle, gets inflamed, and that presses on the sciatic nerve, and then the pain goes down the leg. So a couple things that we can do about it first off. So I'm going to put my little guy down here. I tell every single one of my pregnant patients they must own a tennis ball, a lacrosse ball. This is a trigger point TP ball. And basically what you're going to do is you're going to use this as your personal massager. Now it's hard to sit in there and try to rub on the back of your own glute. So what you can do is sit in a hard chair, take the ball and put it just like you would be putting it in your back pocket. And you're going to sit over the top of those muscles. Matter of fact, what your goal is that you're going to sit right over the top of that muscle and maneuver it around a little bit. Now, to access that muscle, the easiest way to do it is whatever side that's causing the sciatica is to actually bend the knee if you can and put it over the other leg and then put the ball back there and press down on that side. Now, you don't want to move very rapidly over it. You want to hold it for about 10 seconds and then move an inch or two all around it, so that that muscle then can release. Now, a couple of other stretches that you can do for sciatica is the first one is almost the same exact position where you're bringing the leg over and you're hugging it to yourself. And then if your belly's not too big yet with a baby, you can actually lean over the top and you'll feel a little bit of a pull in the back of the buttocks area and the low back. And that will help to alleviate some of the sciatica. Now, I also know this, is that a lot of women have been pregnant and had sciatica with their first pregnancy, and they don't want to have it happen with their second pregnancy. So two things that you can do to try to stave off sciatica. First off, obviously, I believe in getting adjusted frequently. Most of my pregnant patients get adjusted about once a month to twice a month. But the second thing is that muscle, that piriformis muscle, is responsible, and I'm going to stand up here for a second. It's responsible for what they call external rotation. So when the foot literally turns itself out, that is what the piriformis muscle does. So what we want to do is we want to make sure that we try to keep our toes and our hips as straight as possible as we're walking. Because as the belly gets bigger, our feet turn to toe out, and then we start, you got waddle and what have you, and it's not good from there. So try to keep your toes and your knees and your hips all in the same alignment. Now, hopefully that'll help you guys out, and you get good tips from there, and your sciatic doesn't give you any issues. If you have questions, please just ask below the video. Always here for you guys. Talk to you.